Hi, I'm Angie.
And I'm Julie.
Our intention is that you take away from this course an increased ability to be confident in your approach to ultrasound.
We've chosen Small Animal Abdominal Ultrasound because it's one of the most commonly performed ultrasound examinations in practice.
We know that by watching our course, you will be able to take away messages that will help you to become more confident, more competent and more consistent with your ultrasound practice.
What we really hope for is that our enthusiasm and passion comes across in these videos and that you can take away learning tips and tricks so that you too become just as passionate and using ultrasound as often as you can to help in your patient care.
Sound is simply the transfer of mechanical energy from a vibrating source through a medium. Ultrasound is a high-pitched frequency of sound which is above the audible human range. Typically, ultrasound probes generate sound at a range of around 4 MHz to 15 MHz in frequency. So before we even start scanning the liver, I want to get all my initial image optimization done. So I'm checking the TGC here to make sure that we have a nice even grayscale throughout the depth of the image. The focus is set towards the back of the screen. We've not lost too much of the far field here with our depth selection either, so that's quite good. We've got the diaphragm towards the back. There's no point having a depth set where the diaphragm's up here, or you won't be able to assess that structure properly. So that's my fourth sweep through the liver. We've covered the cranial and the midsection in long axis. Now I want to scan through the most caudal aspect of the liver. And this is where we might see some blunting if we have an enlarged liver. And obviously throughout this procedure, what we want to do is make sure that we're assessing that parenchyma. We're not just going through the motions of sweeping through. And as you've just seen there, you may need to adjust your depth or your TGC as you're scanning. So don't assume that you can keep your settings as they are for the entire liver.
The structure of the course is such that you can review and revise any of the modules at any time you need to as you progress through your training.
So wherever you are in your learning, you can build on these skills and revisit them as you require. So I'm going to tell you how I go fishing for the left adrenal gland. So here we have the long axis of the kidney, our left kidney. We're going to use that as our landmark. We're then going to locate the aorta in the far field, which we can see here. And we're going to just slightly rock our probe so that we have the oncoming sound more perpendicular to the edge of that aortic wall. From the long axis of the aorta here, we've got nice and horizontal on the screen. We can now see the vessels arising from the ventral aspect of the aorta, which are the superior mesenteric vessel or cranial mesenteric vessel there, and the celiac axis. And in between that lower pole or hilar region of that left kidney and the aorta, we can see our cheeky little adrenal gland.
We're confident in our abilities as teachers and trainers, so we're confident that you will feel so much better about your ultrasound competencies when you've completed our course.